Cancer Coping Kit. The Cancer Coping Kit was developed to empower you to deal with cancer by providing knowledge and understanding.
Our goal is to equip you with practical tools for use in your daily life and to provide your family members and caregivers with information and knowledge to make this journey easier.
This audio program contains the following information.
Track 1. What is cancer, its treatment and side effects? Track 2. Emotional reactions to a cancer diagnosis and the importance of communication. Track 3. Cancer and nutrition. Track 4. Celebrating life and living positively with cancer.
What is cancer?
Cancer is a disease that has been known and feared for many years. It's not a single disease. There are over 300 different types. The concept that it's incurable is not true, but it can be a serious illness. If you had cancer in the early 1900s, you had little hope of long-term survival. But today your chances are greatly improved. Some cancers are difficult to treat successfully, while others have a high success rate. Cancer is often treated as a chronic disease, as modern treatments are able to control it. It is no longer a death sentence.
Who gets cancer?
Cancer affects men, women, and children. It can occur at any age, but it occurs more frequently as we get older.
What causes cancer?
The exact causes of cancer are not known, and very often no single cause can be found. For a cancer to develop, the cells have to be damaged over a long period of time. The damage to cells can come from smoking, drinking too much alcohol, diet, hormonal influences, chemicals, and many other factors. Cancer is not contagious. You cannot catch cancer from someone else, nor give it to others. Many people believe that cancer always results in pain, suffering, and death. But nearly half of all people newly diagnosed with cancer will be successfully treated. If pain is present, it can usually be controlled. Certain cancers such as breast, colon, melanoma, and ovarian are thought to have an inherited factor. Stress levels will not cause cancer, but can be a contributing factor.
How does cancer develop?
Our bodies are made up of billions of cells that form the organs and tissues of the body. The cells in our bodies that make up the heart, lungs, kidneys, muscles, and skin are all quite different. Cells grow in a controlled way and are constantly renewing themselves. Each day, cells die and are then replaced by new cells. Cancer begins with changes in the body cells. When a cell doesn't follow the normal pattern of growth and death, it grows uncontrollably, forming tumors or lesions. As the cancer cells multiply, they invade and damage normal cells and move into different parts of the body. If not controlled, cancer cells can override the body's immune system. In other words, cancer begins as one single normal cell that changes into an abnormal one. These cells then multiply and form a tumor. Not all cancers form tumors. In the case of leukemia, which is a blood cancer, the cancer cells replace the white blood cells. There are many different types of cancer. Each has its own symptoms, patterns of growth, and treatment.
What is the immune system?
The immune system protects your body against attack and controls cell reproduction. When your body is working well, the immune system is able to fight infection. When your immune system is not functioning well, different kinds of illness can develop, ranging from allergies to cancer. Imagine two armies, the immune system and the cancer cells. The cancer cells will continue to grow if the immune system is unable to stop them. Eventually, the cancer cells will override the immune system.
How does cancer spread?
Cancers can be localized to a specific area or can spread to other areas of the body far from the place of origin. The original affected cells are called the primary disease. The cells that travel into other parts of the body are called metastatic disease or secondary lesions. These cancer cells travel through the blood or the lymphatic system to distant parts of the body where they form new tumors. The spreading process is called metastases. When breast cancer spreads to the lungs, it's not called lung cancer. It is still referred to as breast cancer. It will be called secondary breast cancer. The cancer is therefore named after the original site.
How do doctors detect cancer?
There are a number of ways that doctors use to detect cancer in the body. These include surgery, CAT scans, MRI scans, mammograms, ultrasound, and blood tests.
Why is surgery used to detect cancer?
Surgery is often needed to make a diagnosis of cancer. A small piece of the tumor is cut out and looked at under a microscope to determine the type of cancer. This is called a biopsy.
What is a CAT scan?
A CAT scan uses many X-rays of the body taken from different angles. These X-rays are combined to give a detailed picture of internal organs. Doctors are then able to look for tumors. The CAT scan is a painless procedure.
How does the MRI scan differ?
The MRI scan uses a powerful magnet instead of X-rays. It transmits radio waves through the body and creates a detailed picture of the tissues of the body. MRI scans are usually used to examine the head and brain. It's a painless procedure, but some people find it suffocating as the body is moved through a narrow machine. This is an expensive procedure and is used only when necessary.
If I need a mammogram, what is it?
A mammogram is used to detect breast cancer, especially if the tumor cannot be felt. A special type of X-ray machine produces an image of the inner breast tissue. It's currently the most effective way of detecting early breast cancer. The breast is compressed during the procedure, and so it may be uncomfortable.
You also mentioned ultrasound. What is this?
Ultrasound uses sound waves to generate images of the organs and tissues. The skin is covered with a jelly-like substance, and a probe is passed over the skin. The image is generated onto a screen.
What then is a bone scan?
Bone scans are also used to help detect and track cancer. A bone scan starts with an injection of radioactive material. This is drawn to the area of the body where extra bone activity is taking place. The body will be attempting to repair damage here. Doctors are then able to see these areas of extra bone activity, common in both cancer and arthritis, using a special camera to see the injected material.
My doctor used the term blood markers. What are they?
Not all cancers produce markers. With those that do, blood markers can be used to detect possible cancer activity in the body. With cancers like ovarian and prostate, blood markers are also used to monitor how the patient is responding to treatment.
My doctor has said that my cancer is at a certain stage. What does this mean?
Doctors classify 4 stages of cancers. According to these stages, it's possible to know how far the disease has spread. Stages 1 and 2 usually show that the cancer is in an early phase. There is no distant spread and it often responds well to treatment. Stages 3 and 4 show that the cancer cells have invaded surrounding tissue or spread through the blood vessels to different parts of the body. It is therefore more difficult to treat.
My doctor has given me a prognosis. What does this mean?
Prognosis is the measure of the likely outcome of the disease in terms of your recovery. The doctor will give a statistical evaluation of the future course of the patient's life. This is based on data obtained from hundreds of patients with a similar condition. It does not take into account the individual reaction or response to the disease and treatment.
People are said to be in remission. What is this?
Remission is a complete or partial disappearance of the signs and symptoms of cancer after treatment. In other words, the disease is under control. This may not be the same as a cure.